All right, then I will turn it over to Rob and we'll start recording the meeting. Rob?
All right. Thank you very much, Christopher. And thank you, Christopher, to organizing this and helping out with the Zoom, and beyond my technical ability to create a Zoom meeting. So I appreciate Christopher's help there. Welcome, everybody. This is kind of a new thing for us, new and old. I mean, new to the networking luncheon. But it's kind of old that we've been doing this for about 6 months now, since COVID has really been a huge factor in our lives, and we are doing this. I mean, I haven't been to an in-person meeting in 6 months, so everything is Zoom oriented, and I would imagine a lot of you are all in the same boat as well. So welcome, and this is we're gonna hopefully be successful in this, and in some ways it can be better. You know, you don't have to drive. You could you don't have to eat the food that we bring. You could eat your own food, which may be a blessing. So we're going to go ahead and proceed. A couple of things on MERIL. I just want to talk a little bit about us and what we've been doing. First of all, as you know, COVID has been probably the thing this year. Our office is officially closed to participants and outside folks. However, if you need to see one of our specialists or have a meeting, you can come and set up an appointment, and we could meet you that way. But by and large, we're trying to do things virtually or going to your home. A lot of our services are already provided in the participants' homes. So our CDS attendants and our in-home PCAs and our nurses are already going to the home. So that really hasn't changed. We had earlier, and we still do a little bit of telehealth in terms of our nursing visits. So that's a little bit of a difference, but we're sort of phasing that out, and we're actually going into the homes primarily for nursing. So our office is, like I said, it is closed to the public, but if you need an appointment and want to see us in our office, we can provide an appointment and meet you in our office. Everybody wears masks in the hallways. You don't have to wear it in your own office. We do social distance. We're very diligent about that. Our facilities manager also is very diligent about keeping our office clean with wipes and wiping down things and that sort of thing. So we're doing a very good job there. So I hope all of you guys are doing that in your office as well. So COVID has really impacted our service provision, and we've adjusted accordingly. Another thing I want to talk about is obviously the election season is coming up. Voter registration is a big thing for us, and actually getting people to vote. As you all know, or maybe you don't know, the voter registration deadline is about a month from now. I believe it's October the 7th. And if you have participants who are interested in voting, remind them that they need to register with their county clerk. And then there are several ways to vote. There's absentee, there's mail-in this year, as well as going to the polls, and curbside and those kinds of things. So I think it's important that everybody gets educated on those things. So we're pushing out the voting. It is a huge election, big election this year. So make sure people get to exercise their right to vote. So we're stressing that as well. Again, always we need PCAs in attendance. That's really the lifeblood, the cash flow for our organization. The fee-for-service dollars that we get through our CDS, in-home, and our nursing programs are vital to the organization as well as the people we serve. So if you know of anybody that wants to be an attendant or a PCA, it's a very noble calling. It's valuable work. We need those individuals. We're always hiring. So feel free to get a hold of our office, and we could direct you to that. The CDS program and in-home programs are a little different, but they're similar in the respect that the services that are provided in the home are very similar in terms of like housekeeping and hygiene and that kind of stuff. So we definitely need PCAs in attendance. One of the other things I want to touch on briefly is assistive technology. For those of you that have worked with people with disabilities, we have a host of AT or assistive technology devices that could be demonstrated to you to pick the best of one or two or three items, or there's ways you could actually get alternative phones and alternative wireless devices from MERIL. So give us a call if you have folks that are needing these alternative communication devices or magnifying glasses or alternative phones. We have a lot of assistive technology in our office that we want to make sure people with disabilities have access to. So Again, we're moseying along. We're still doing the things we do best, providing great services to people with disabilities in Northwest Missouri. We encourage you to make referrals to MERIL, and of course, our information referral specialist also makes referrals to your organizations as well. And that's one of the main things about these networking, I guess we call them networking luncheons, but networking Zoom calls or whatever we call them now, is learning about other organizations to see what services you all provide. So if you have a participant or if you need services from that organization, you're a little bit more well informed. So really that's about it. We don't have any, again, with COVID, we don't have any public events. Like last year, we had a Halloween bash that drew about several hundred people. We don't have that because of COVID. We don't have some of these other things that we usually do, like the Brain Injury Association meetings. We don't have that because of COVID. So we're adjusting to provide services either virtually or one-on-one in the home. So that's kind of where MERIL is. We're still working with all the other centers for independent living to make sure that everybody, the whole state is covered in terms of services provided to people with disabilities. So I've probably allotted my 3 minutes, and I'm gonna, if there's any questions you can ask, probably at the end would be best. If you have any questions for any of the organizations, that's probably what I would do. Maybe write a note or something like that and then ask at the end. But in any case, welcome. I'm glad you're here. And it's great to learn about other organizations. So I'm going to turn it over to Christopher. And is Red Cross going to be next, Christopher? That looks like the next one on the list. And I don't even know if William is with us at this point, or Debbie. So I'm going to go ahead and mute mine, and whoever's next, we'll go ahead and go. Is Red Cross here? I guess if not, Christopher, we could just go to the next one, I suppose.
This is Bill Caldwell with the Red Cross.
The floor is yours. Go ahead.
Okay, well, for us with the Americans with Disabilities in our shelters is our primary, and we have taken this tack that we're going to use congregate shelters as little as possible. For instance, we just worked the South St. Joe flooding, and we put everybody in motels. Granted, that was 119 people, but we did not, and it would have been a lot cheaper to open up shelters. However, in Texas, Louisiana, we have 22,000 people, and of the 22,000, only 2,000 are staying in a congregate shelters. Everybody else is in a motel. We make sure our congregate shelters are ADA, and that's about it for us, but it has been a strain on us with COVID-19.
Thank you for the information.
And also, I just got off another call with the South St. Joe. We're strapped for volunteers because we just have to have, if we have shelters, and we do have more hurricanes lined up coming across. So we're right now getting into the peak hurricane season, and we've just got our fingers crossed. So, any other questions?
I did have one question. I appreciate the information. Is the main reason you guys are doing hotels versus shelters is because of ADA accessibility reasons?
That's a big reason. And when we do, and I do some shelter or partners, we make sure, like if we partner or have a memorandum of understanding with somebody to use their facilities, that's right there on our list, is that they're compliant with the ADA. The church, if it's a church, if it's a labor union, any big facility, a gymnasium, that's on the checklist before we sign a memorandum of understanding or partnership agreement. So that's primarily it.
Thank you.
And then of course our blood drives, we have social distancing, and again, we urge people to donate blood, and everybody's low on blood right now. People just do not want to get into a facility, but we're making some progress on that. And I do a little bit of that. But, so any other questions? Hearing
All right.
none, I will mute and listen.
Thank you so much, William. All right, next we have Fairfax. Do we have Julie or Heather with us?
Good morning, this is Heather. I'm a nurse at Community Hospital Fairfax, and I think Julie was going to join us later. She is the CEO. And I'm here with Holly also. She's another one of the nurses. What we wanted to present about today is we are the nurses who do our population health management through a program called Chronic Care Management. And it is a care coordination service that we do. It's done outside of regular office visits for patients that have 2 or more chronic conditions that are expected to last at least 12 months. And it places them at significant risk for acute exacerbation or functional decline. And the services that we do are typically non-face-to-face between a nurse and the patient or the family or caregiver who works with the provider. And we kind of do this all in the purpose of ensuring well-being in between office visits. The CCM service that we do is covered by Medicare, and it's offered to all patients, like I said again, with 2 or more chronic conditions. And it's comprised of a team that includes the primary care provider, one of the nurses, the chronic care management nurses, and then the patient and the family. And the goal is that we improve self-management and ensure smooth transitions of care in between admissions or discharges or from one facility to another. And then also just to help reduce the burden of chronic diseases. We have seen and know also that just like everyone else has mentioned before and probably will after about COVID and the effects of that, obviously our patients that are older and have 2 or more chronic conditions are ones who aren't wanting to come into the hospital, but we know that they have greatest need for managing those things outside of here and then keeping in touch with them and making sure that any changes are notified or shared back with their provider to help keep them healthy also in between these times. So we've seen a real benefit with this program even before COVID, but also after. The other benefits of the program are we create a comprehensive care plan that's patient-driven with individual goals to help patients manage their diseases. The patient has access to a nurse or someone on that care team 24/7. And we just kind of help them manage their diseases and stay on track in between office visits. And we focus on prevention and wellness while helping them assist them navigating through the healthcare system, as well as the reason we're super excited to be here today is we really help our patients get in contact with community resources because we know there are a lot of social determinants of health that can really impact their management of their chronic conditions. And so we utilize you guys, and we're super appreciative to know all the services that you have to offer so that we can make sure our patients are aware of those too. So we just wanted you to know what we are doing with our providers in managing these things, and then how we actually reach out to you guys and are here to make sure that we're aware of all those extra things that our patients may need in the meantime. So thanks for letting us come today. And if you have any questions, we'd be happy to try to answer them. Thank you.
Thank you so much. All right. Barbara, I think, is here, and it's Bernie as well. So you want to go ahead with the Health and Senior Services update?
Yes. I work for special health care needs, and my role, Bernie and I do different roles, and my role is as a nurse service coordinator through the Missouri Department of Health, and we work with families who have children who have disabilities and are also on fee-for-service Medicaid. So the individuals who are in managed care don't come to us. They have to, for their in-home services, they have to go to their managed care company. But for those who are in fee-for-service, then they come to us and we do an authorization and provide those services that the family needs within the confines of what Medicaid allows. Since March, we haven't been doing any in-home face-to-face visits. Normally we see our clients every 3 months. Now we're doing all of that by phone, and that's because so many of our clients are high risk. So, but if you have somebody, if you have a question, please give us a call and we will definitely do an evaluation and determine if they need services. And if they happen to be in managed care, we'll tell them how to get their services through managed care. Bernie, you got anything to say?
Actually, yeah, I do. I always have something to say. Different from Barbara, our focus is more on helping families get DME equipment, helping them pay for medical bills and medications and those kind of things that Medicaid does not cover. Unlike Barbara's program, our kids don't have to have insurance or Medicaid or anything. They can be someone who is uninsurable for whatever reason or can't afford the insurance. Our kids are all birth to 21. They do have to meet eligibility guidelines, and there are some financial guidelines, which is 185% of poverty level. And so that is, we quantify that by, like this year, we're quantifying with 2019 income tax returns. And if they don't have to file returns or they're in the foster system, that is a waived part of our program because they don't have to worry about meeting a financial if they don't have to file. We also, like Barbara, have been unable to do face-to-face meetings with our children since March. And it'll be, they're doing it a month-to-month for us right now, but I'm anticipating that we won't be back in the homes at least the rest of this year, but we don't know that for sure. Haven't really had any issues with our kids who've been on the program a long time because the families know us and we know them. New enrollees is a little bit of a challenge because we don't have the opportunity to sit down and evaluate their home and what the needs really are, except what they're telling us. We are fortunate in that our DME providers, if we're needing ramps or adaptions of some sort, they are able to go and do that for us so far. So that's been helpful. But we're busy as usual. Our office is in Kansas City, although we cover that region. And we are available for consultation, consult, and any referrals that you may have out there for kids who meet our criteria. I just recently did mail out to all of our schools because I know a lot of them in Region 1 are going to be back in session, especially our smaller districts in the rural areas. And I wanted to make sure that they knew we were out here in case their kids needed anything. So I think that's really about it. Calls can come at any time. The phone numbers are on our information, and there is our main website, which you can get all of the information you might need.
Okay, Barbara and Bernie, I appreciate it. Good information. Any questions for those two? I have one question, Bernie, for the DME for the kids. So you mentioned, what's your region again, your area? I can't recall.
I actually have 17 counties in the northwest corner of the state. So from all the way from the Tarkio type area, Atchison, all the way down to Cass County is my area. We do have on the website, you should be able to find a map of our areas, but all of the counties from the Iowa line all the way to Cass County on that corner of the state are ours. Region 1 is the 12 counties in the extreme northwest part of the state.
Okay. Thank you.
Mm-hmm.
Any other questions? Well, if not, I will proceed to Tasha. I believe you're here. So I'll go ahead and turn the floor over to you. I thought I saw her up there. If not, maybe we come back. I don't know. Is Tasha here? Okay, if she, well, let's go into the next one. If she does come, we can come back, I guess. So Rita, Northwest Missouri Regional Council of Governments, is Rita here? I don't see. All right. If not, then if she comes back, anyone from Second Harvest?
Hi, this is Lana from Second Harvest. I'm a community outreach coordinator. Our operations are up and running. We have not been shut down for any reason. Actually, we are going above and beyond with the amount of food that we are putting out to our communities. We do have 19 counties that we serve. Most of the coordinators are working from home, with the exception we take turns and go into the office one day a week. One thing that we have changed is any partner agencies coming in to pick up items and so forth. Everyone is required to wear a face mask. So even when we are in the office, we are wearing a face mask just to, you know, be safe, not only to ourselves, but we do have a National Guard that's been assisting us. We are also focusing on SNAP. We know that there's a huge need out there, especially with the unemployment rate as it is. So we are doing a lot of social media, trying to reach out to folks because they can't come into the office for us to assist them, but making sure that they have our business cell phone numbers that they can call. We are doing the SNAP applications over the phone. Also reaching out to our partner agencies to make sure that they know that that assistance there, and they can always provide the number so they can call us, and keeping them updated each month on any changes that might be happening with SNAP. I do know that the income guidelines will be increasing as of October 1st, but that's not information that we have released out to the public at this time. Mobiles, we normally do 26 distributions a month. We have been doing anywhere from 90 to 100 a month, reaching out to our different communities, and we appreciate all the hard work that they have been doing. Our fiscal year actually starts as of July 1st, and as of July 1st, just with our mobile distributions, we have done 1,449,681 pounds of food, and that's going out within the 19 counties. So again, we would not be able to do that if we have not had the assistance with the National Guard. So they have been a huge part of making this happen for the communities.
I had a question. Are you guys doing the food fight again this year?
You know, that would be a question that would have to be directed to our fundraising team. I do believe, yes, it may look a little different this year. We are also doing what is called fill the vans, and any items that's collected for that, we are using to put into our campus cupboards, which are within some of the schools. And just, you know, for an example, Highland College would be one of those. They have a pantry set up, so we provide items for the students on campus.
Great information. I appreciate it. A lot of
Sure.
food, by the way.
It is a lot of food, and you know, it's been a great success. But again, we couldn't do that without our partner agencies helping, but also with the National Guard there to help as well. We're a small team, so it's taken an army to make this happen.
Okay, thanks so much. Any other questions? Okay, is Evergy, is Maria here?
I'm here.
Is it Evergy or Evergy? How do you pronounce it? I'm sorry.
It's Evergy.
Thank you. Because
Yeah.
I kept saying Evergy to me, but now I know.
No, I completely understand. No, hello everybody. My name is Maria. I am a customer affairs advisor with Evergy. The territory I cover is everything that was former KCP&L. And basically just to give you some little background on my role, I'm the one who's responsible for the outreach and education for our income eligible programs, our medical program, just out there letting customers and agencies know what we have available. Today, I just wanted to go over, I see on our slide here, the section about the limited time payment plans. And, you know, our moratorium for disconnects did end July 16th. So we have been disconnecting since then, but we are offering special payment plans for those customers, because we know people are struggling, especially now with everything going on. I just wanted to highlight one 12-month program that we are offering. Basically, it's for customers with active accounts, or even those customers who just have old bills and are trying to get new service. There is a payment plan available where they would only have to pay 1/12 of their balance in order to get set up on a payment arrangement. This would basically split the remaining balance over 12 months is what that would do. So again, that's something that we are promoting heavily to our customers who call in. We are also no longer doing late fees or deposit requests for the remainder of the year. And I'm sure they'll look at that again come January 1 to see where everything stands. One other thing I wanted to promote today is a program that's not getting as many enrollments as we were before, and that is our Economic Relief Pilot Program. Now, this is a partnership that we have with Salvation Army, and it's for customers who are at 200% or below of the poverty level. So it's quite a bit up there. We're glad about that. But again, this is for customers who are either on a payment plan, who are able to keep up with their payment plan, or those customers who are still making their monthly payments but still could benefit from some additional help. And basically, if a customer qualifies, then they could receive up to $65 in credit on their electric bill every month for a whole year. So for 12 months, which is a great thing. And again, it seems like right when COVID, you know, mid-March, when everything hit, is when those enrollments went down. And of course, we're thinking that's due to, you know, we were not disconnecting for several months. People had other priorities on their mind, which is totally understandable. But we do want customers to know that that is an option available for them. And another thing also, we are, meaning Evergy downtown, I'm based out of the Kansas City location. We are home for the remainder of the year, so we are doing everything virtually. So of course, the resource fairs, the back to school fairs, everything has come to a standstill. So we're trying to do everything via Zoom or via Teams call. But I also want agencies to know that I'm available to meet with their staff virtually, just to go over everything that we have to offer. Like I said, we have a medical program, we have weatherization, of course, economic relief, and we're always promoting LIHEAP, which is the low income home energy program. So if there's a time where I can set up a meeting to meet with you and your staff just to go over everything, I'm more than happy to do that. You can reach me at maria.lopez@evergy.com. That's it.
Well, that was perfect. Good information. Thank you so much. Any questions? And I appreciate the clarification on the pronunciation.
No problem.
Questions for Maria? Okay, thanks. Is Dottie here? I think I saw Dottie. Or maybe I didn't. Anyone from South Nodaway? All right, we'll move along to Megan. Anyone from Ability KC? Okay, Catholic Charities. I think you have to unmute.
Yep, I am here.
Okay, thank you.
Yeah, you got to be ready. You don't know how quick you'll go here. We are, let's see, I'm seeing what somebody else sent the flyer, so I got to see what was sent. And they've sent a flyer for St. Joseph. We have a welcome center in our St. Joseph office where we can do emergency assistance for utilities and rental assistance. Some of those programs sometimes can serve Nodaway County. So if you need any of those kinds of assistance, rental, utilities, sometimes it's tied to eviction, sometimes not. It just depends on the funding that we have at that time. So it's always worth a call to Catholic Charities, to our St. Joe office, to ask if we have funding for Nodaway. But the services we have all the time in Nodaway, or in Maryville specifically, are our housing program. So we serve the formerly homeless. We have about 25 households that we house in Maryville. And then very active is also our children and family services, our Moms Empowerment Program. So that program serves mothers through their pregnancy and then the first year of the child's life. And they provide monthly education, case management, and they also provide monetary things like pack and play, diapers, wipes, those kinds of things during that time period that they're serving them. Our housing program, we provide, we pay rent and utilities, depending either the whole thing or a portion depending on what the person's income is. So our goal is to get them people working and so that they eventually get off the program. And so that's our main thing. We have just now, within the last couple of weeks, started seeing clients in our St. Joe office for our Welcome Center. We see people, we are wearing masks, and so we're kind of business as usual in the office, but we're not all back in the office. We're working at home part of the time. And our case managers for housing have just started seeing clients at their discretion. So we're still not 100% seeing clients, but we do video calls to our clients. So we're trying to act as much back to normal as we can within the circumstances.
I had a question.
Yep.
Now, are you guys administering the housing, I don't want to say project, but housing on Pear Street in St. Joe?
Yes. Yeah, the St. Charles Parish, yes.
Right, and for some reason I thought that was going to be up and running in July. It looks like they're still under construction. Do you have an update on that?
Yeah, I was just there the other day actually by there, and it does still look like a construction project, but they are supposed to start moving some people in the end of September. There's 38 units and 1 and 2 bedroom, mostly 2 bedroom. It is income based, and so people pay a portion of their income for rent. I think the 2 bedrooms I think are $550. Don't quote me on that. But they're actively taking applications, and you can call our office. It's a management company that is actually doing the applications, but we can give you the number. So I think they only have about 15 maybe that have completed applications and are spoken for and that are ready to move in. So, but it looks like end of September for sure. Most of the units should be occupied by October. And they look like they're going to be pretty nice. They're smaller, but they're the materials they use look like they're pretty good quality, so they look like they're going to be nice. And I know so much percent of the units I think are devoted to people with disabilities specifically. So I think maybe 10 units are for that. So I mean, anybody could go into any of the units, but I think 10 are specifically towards people with disabilities.
Thank you.
Mm-hmm.
Any other questions? People aren't asking me. I hate to be monopolizing this, but I wanted some questions. But all right, if none, we'll go ahead to Linda's here. Linda from Iowa, you're up.
Yeah, good morning. So I want to thank MERIL for hosting this again. Actually, I think your lunch would have been better than my lunch here at home because I don't do much cooking. So, so Nodaway County Services, we are located in Maryville, and we've had a lot of changes going on in the past few months, and in particular in the past couple of weeks. Our longtime executive director just resigned 2 weeks ago. So my boss, Mark Para, is serving as interim executive director while we search for a replacement. So that job has been posted. My division, Turning Point Division, we deal specifically with behavior and crisis services. So the good news in our area, we now have a licensed behavior analyst. Mark Parra just got certified in June. And so after he got his certification in ABA, he became the clinical director for Turning Point Behavior Services. And before very long, we've got another person on our staff who will also be certified as a behavior analyst. That is Tina Hazen. So we are really excited about that. In Northwest Missouri, it has been very difficult in the past to find anybody to do behavior services. There just weren't that many people available, and then they had long waiting lists. So we're really excited to offer this to our area. Primarily, we focus on the 7-county region up in Northwest Missouri. We work primarily with individuals with developmental disabilities. Obviously, they would be experiencing high behaviors. They may live in group homes, ISLs, or with their parents. Our behavior analysts can also go into school settings to consult with educators. We also have a new behavior home. So we've designated that home specifically for high behaviors, and that is a 90-day transitional home. We can accept transfers to the home, assess the situation, provide data and information and trainings to the staff of the home that the person will transition into after they spend the 90 days with us. So typically the people that move in, they can be from anywhere in the state of Missouri. Typically they are listed on the database. In providing the behavior services, the information that we provide to the staff at their new location helps them find a home that would be least restrictive. Because if we can get a plan set up and identify the things to help the individual live a better life, we typically reduce restrictions, and then providers are typically going to be more willing to accept the transfer of somebody who's got a good behavior plan in place. Also, in addition, our department can provide training on a contractual basis for a variety of industries on several different topics, such as organizational behavior management. We can provide supervisor trainings customized to the company's needs. And most importantly, we can help in the areas of worker burnout using acceptance and commitment training. While we still currently offer person-centered strategy consultation, this service is being phased out. The Departments of Mental Health has decided to cut that service effective March 1st, 2021 for budgetary reasons. But we still have clients right now that we are serving with PCSC services. So that's all I've got for you. If you've got any questions, or feel free to email me or call to find out more information.
All right, I appreciate it. Very thorough and to the point.
You're welcome.
Okay. If there are no other questions, then we're going to go ahead and go to Monica Bailey, and I know Monica's with us. So Monica, you're up.
Good morning, all. I'm looking through this list of outstanding organizations. I'm sorry, I only got here a few minutes ago, so I missed all your updates. I just wanted to, basically, Atchison County Development Corporation is who I represent. We're the economic community development arm for Atchison County. So really, I know that you guys see on our website, the slide that we have pulled up here, we started a COVID page back in March, thinking at the moment that I haven't updated that for a little while. We were pretty static in our status for several weeks, and I don't know if Heather mentioned earlier, but we've recently had an uptick in cases, and so we've had some closures that I need to update that with. But we created that just to be, one of the things we do is just a general informational resource for the county. So we just put that together so everybody could have a spot to put information in one place. Otherwise, in general, we support new businesses as they're getting started. We help existing businesses expand and grow. Our favorite thing to do, which is the hardest thing to do right now, is emerging workforce, aka youth career opportunities. We have several different career programs we do for Atchison County students, mostly high school age. A lot of those, one got canceled in the spring, and we are looking at a fall that's not going to look at all like normal. So we're trying to pivot a little bit and figure out how else to get them that information. But otherwise, yeah, we're funded by a 1/4 sales tax. And so we basically work for the county. We're tasked to do economic development, but in small counties like ours, as you all know, it's a lot of community development as well also. So we tend to just work wherever the need is and just help the county grow.
Are there any questions? Just want to say, we had a couple of, just real quick, did anyone join us? I know we had a couple of organizations that did not make it. We want to give them a chance if they did come. Looks like not. I just want to say thank you to everybody for being succinct. I think you all abided by the 3-minute rule for the most part. So that was very appreciative, and a lot of really, really good information. And I know I may turn it over to Christopher, but I think what he does is he emails a lot of this information out to you all so that you have it. Christopher, do you want to chime in real quick and let everybody know exactly what you do? And also, when is the next Zoom meeting, the next networking Zoom meeting? And I forgot to put that into my list, and if you don't mind letting folks know about that.
Yeah, no problem. Yes, I will be emailing the recording of this meeting to all of the attendees and the couple of folks who couldn't make it today. And we'll be posting it on our YouTube page and on our Facebook page and website. So it will be available for the public to look at and for anybody else, other coworkers you have. We're going to be encouraging our coworkers and participants and anybody who follows us in our newsletter or on social media, to watch the video if they're interested. They can kind of skim through and get the highlights and see who's listed, and hopefully it'll be a nice way for us not only to get together and talk to one another, but also to share information with the public. And even if somebody comes across this a few weeks from now and they weren't able to make it today, they still have the opportunity to hear what everybody said. So that'll be coming out maybe tomorrow or so. I have to edit the video and get it posted. Also, along with that will be a quick survey about the event. It really is quick. It's 2 minutes. It's just it's a rating of how do you think it went and any suggestions you have. But also in those surveys, we ask a question that is something that we've been asking for a few years, and we have found it useful to hear the responses to the question. And that is, what do you see as the top 3 unmet needs in your community? So that is actually the first question on the survey. That's kind of the main thing that we like to collect from the survey. We have typical responses: housing shortages, affordable housing, healthcare, things like that. But whatever you see as the top 3 unmet needs, please feel free to share those in the survey. Our next networking meeting, as we're calling them now, is October 1st, and that will be for Buchanan County and Andrew County. It will probably feature more speakers, and so we'll have to think about whether that's going to be a 2-hour meeting, and certainly letting people know in advance kind of where they fit on the agenda. So if they need to come in a little bit later or so. They don't want to stay the entire time. So hopefully that information will be helpful to the attendees to know in advance if we do have to have a larger meeting for Buchanan and Andrew County. Those are usually the most popular, the most attended meetings we have. And then we have another one. It's the first Thursday in November, and that will be for the Cameron area. And then also Gentry and Worth, I believe. Yeah, those meeting dates are available on our website. It's meril.org/resources, and that's also where you'll find the link to this video and before we did the Zoom videos, we would scan handouts and business cards that people shared at our in-person networking meetings, and we have those as PDFs available on that website as well, meril.org/resources. So you can kind of skim through there and see who attended in the past and what they shared. Other than that, I think we'll just kind of open it up. We have it scheduled for 11:30. Feel free to step out if you're done, and if you need to do something else. But if you have further questions or a general discussion, we can just open it up to that now, I think.
I have another thing from Catholic Charities. I completely forgot. We just got a good sizable amount of money for Department of Corrections. And it usually is in Buchanan County only, but it's expanded to Nodaway County. And it has to be spent in a pretty short amount of time. So if you have anybody that you know that's ex-offender, they can offer, I think, help with rental assistance and just a wide variety of things that people need just in general in their life. So that'll be a big thing for a short amount of time, which is usually how it happens here at Catholic Charities. Lots of money, short amount of time.
A bunch of shy people today. I think everybody's used to the Zoom thing, so it's going to be weird getting, if we ever go back to what we were, it's going to be very interesting. I have to reintroduce myself to peopling. Anything else?
Yeah, this is Bill Caldwell again with the Red Cross. The flooding last year in Northwest Missouri, I led the external relations team up there, and I think I remember quite a few of the faces and names I've seen on here today. But not only do we shelter people, but we also work in Northwest. My home chapter is the St. Joe chapter, which has now been put into as Northwest Missouri. So I appreciate all the assistance we got in the flooding in Northwest Missouri last go around, and hopefully we won't get too much again. So again, thanks again to everybody that's on here today. Thank you.
And thank you for joining us and the good information you gave out. I guess we could wrap it up. I mean, I think this is a very good first Zoom one, just a shade under an hour. Everybody was pretty succinct and to the point. And like Christopher said, this information is still available if you missed it on our website, or just give us a call and we can direct you. I just want to say thanks again, and hopefully you could attend the next one, which Christopher said is October the 1st. And I have nothing else. And if anyone else has anything, we could stay on for another minute or two. Otherwise, sounds like we could adjourn by 11 o'clock.
Thanks, Rob and Chris.
Thank you.
Thank you.
Well, I could officially adjourn it since I have nobody chiming in. So if you want to just go ahead and leave and have a great rest of the day, and we look forward to seeing you hopefully on October the 1st.